There is an insidious disease eating away at our country, a silent killer, hiding in plain sight for all to see. Warren Buffett said, "It's like a tapeworm eating at our economic body." Others have called it a cancer that is sapping our nation's strength and vitality. I call it what it is, our grossly overpriced healthcare system.
Food is becoming more affordable, healthcare is becoming more unaffordable.
So much so that the average American family has not seen an increase in their standard of living net of the cost of healthcare in decades.
Yeah, I think it is a crisis level.
From Truman to Trump, runaway costs have infected nearly every aspect of our lives.
Someone has calculated that over your lifetime, when you add all of these costs up, hidden and out of pocket, over your lifetime, without you even knowing it, you spend $1.9 million for health care, more than you do for a house or anything else, and you don't even know it because most of it is actually hidden.
We have fooled ourselves into believing America has the best healthcare system in the world. What we actually have is by far the most expensive healthcare system, which, when everything is considered, doesn't even rank in the top 10 in the world.
It doesn't have to be this way. We must do better.
Welcome to West Health's Innovation Summit. Today, we put a stake in the ground and focus on practical solutions that can slow the trajectory of healthcare costs in America.
One word to describe healthcare in the United States today.
Expensive. Turbulent.
Fragmented.
Mess. I'm still perplexed that the U.S. healthcare system is 18% of GDP, by far, per capita, the most costly system in the world, and yet our outcomes are not commensurate with the cost.
We all must rise to the challenge because the tide is already turning thanks to the great leaders who will share this stage with me today.
They'll not only examine the issues that we face, but also offer actionable solutions. Solutions that can not only slow the trajectory of healthcare, but also help create a healthcare system that's more accessible, affordable, and ultimately sustainable.
Delivering cutting-edge care for quantity and for quality of life is in line with what we are all looking for.
But most patients I speak to in this current system feel powerless. And that's what I think we have to change.
Americans deserve a new model of healthcare, one that rewards value over volume, transparency over secrecy, and patience over profits. Here are 3 reforms we need to implement ASAP. We've tolerated an outdated, misaligned, and in some cases, borderline criminal fee-for-service payment model far too long.
What do you think about fee-for-service?
We have to talk about value and where are you going to get the best result, the most effective outcome for the lowest cost.
Fee-for-service is the kind of shackle that makes someone say, I only have 6 minutes per visit. So once you change the shackles of fee-for-service, you can unleash kind of attention where and how and with the intensity that's necessary, and that's how I think you can have that kind of conversation.
I think a value-based system makes sense for everybody, and I think the surprise is for the practitioners as well.
And we have to enable people to figure that out.
Do you think Medicare should be able to negotiate the price of prescription drugs?
Yeah, I mean, I think that's come up just about everywhere.
Everywhere.
I mean, of course,
you think so?
They should. So 50 to 60 million people have that leverage. I think they should be able to negotiate, and I think it would help a lot. Probably top of the list for me in terms of lowering prescription drug prices.
It's all about price negotiations, most of which are not transparent. The government, the VA, does benefit from the private sector negotiation, and that they kind of automatically get a lower price.
When I was overseeing the Medicare program, I couldn't understand why Secretary of the VA could buy drugs for veterans at prices way below what I could for the American taxpayer. And I still don't understand it. Now, I understand it politically. I understand how that's our political system works, but it doesn't really make sense that the veterans can get a lower price than we can for Medicare seniors. So I think we've got to do something about that. I think we can do it in a way that doesn't inhibit the ability of drug companies to innovate.
The notion of having Medicare have leverage at the table for the drug pricing here in the U.S. Can we use the heft of Medicare to start negotiating on those prices?
How big a factor is transparency in solving this problem and helping patients?
People don't understand the costs. There's no transparency of costs really whatsoever, and even if you start to look behind the curtain, it won't make sense to you because the numbers are constantly changing. Even within an institution, they're changing.
And if you ask, as indicated earlier, what something costs, what a treatment costs in advance, you're going to get a very strange look. It means one of two things. Either you're uninsured or you're crazy. Why would you want to know the price? What's it to you? They try to make you passive. Oh, insurance will cover it. Maybe. Yet 3 years later, you're getting bills where you need a Rosetta Stone. How do I translate this thing?
The system is not transparent. It's horribly complex. You get these crazy bills, and P.S. they can wreck your credit ratings. Patients say to me, we need to know the prices because we're paying them.
People consistently say they want to know what things cost, and they're outraged when they can't find that out. The problem is that not that the information isn't there. It's there, it's just not made available. More competition leads to better quality of care measured in patient outcomes. Less competition, the opposite, worse, actually substantially worse patient outcomes. And the evidence shows across the board, when there's less potential competition in a market, hospital prices are higher. I think it's time for a national healthcare data warehouse so that businesses, governments, both federal, state, and local, and individuals know what things cost and know the quality of care.
Buyers are at extreme disadvantage in many situations where they have less information than the sellers. Increasing information is able to close some of those gaps, and I think there is high value to increasing the transparency about the costs and of the value of care.
So I would just summarize, I'd say our two greatest threats right now in the country, is for making progress on healthcare. One of them is cost. Again, whether you believe in coverage for all people or whether you don't, you're going to have to go through and deal with cost. And the second, and I'd say probably at this point of equal importance and of equal challenge to us now as a country, is how broken our politics are.
We need new and vigorous policies to address this. If we fail, I think we're very likely to have an even more expensive, even less responsive, and even worse system than we currently have.
It's really clear that a lot of these issues find their solutions in the policy world. Right. If you're running for governor, if you're running for Senate, if you're running for House, you have a role to play in fixing this in one way or another. And so I think making this an issue when people are running, asking people what it is they're going to do about it, I think is going to have to be part of the solution.
If our representatives in Congress can't forge a rational path forward, and quickly, then we need to elect policymakers who aren't afraid to put patients before profits. Together, for the good of America, let's turn outrage into action, turn smart practice into policy to make sure high-quality, affordable health care becomes a right. We live in the greatest country in the world, but if we don't do something about the damaging effects of ever-escalating healthcare costs, we are risking the very health and wealth of America. And we cannot afford to do that. Not now, not ever.